Thanks for watching. This is YouTube Medical University. This time I'm making this video in a hurry, but from April of Rewa 6, the baseline for high blood pressure has been raised from 140 to 160. There have been many comments asking me to explain this. If the baseline for blood pressure changes, that's a pretty big deal, but there hasn't been much coverage of this in the news. It's said that 1 in 3 adults has high blood pressure, with the baseline raised by 20 points. People who were previously considered to have high blood pressure are no longer classified that way, and it's said that the number of people considered to have high blood pressure will decrease by about 1/10. This is quite a significant change, isn't it? So this time, from the perspective of a doctor who actually treats high blood pressure, I'll talk about what's really going on with this news, the background behind it, and what it means for people who actually have high blood pressure or are worried about their blood pressure being high. I'll be sharing information that will be helpful for those people. Please watch until the end. High blood pressure is known to increase the risk of cerebral hemorrhage and heart attacks, but low blood pressure can also be risky. There's a lot of information out there, some of which is inaccurate or outright wrong. As a doctor, I'm sharing this responsibly to prevent you from being misled. If you find these videos helpful, please consider subscribing so you don't miss any new content. That's all for today's intro. First, let's take a look at the history of blood pressure guidelines. Over the years, the standard values for high blood pressure have gradually been lowered. What could be the reasons behind this trend? Next, I'll explain the differences between domestic and international standards for blood pressure, as well as the differences between guideline standards and those used for health checkups within Japan. In the third section, I'll explain the pros and cons of lowering blood pressure. The fourth section will discuss what to ultimately believe and how to approach high blood pressure. Finally, while treating high blood pressure is important, it's not just about medication. There are other factors to consider as well. To avoid developing high blood pressure, or even if you already have high blood pressure, I'll explain in simple terms from a doctor's perspective how to lower your blood pressure through diet, so you don't have to rely on medication if possible. Now, let's take a look at the history of standard values for high blood pressure. Back in the 1960s, the standard value for high blood pressure was actually your age plus 90. The standard blood pressure values were age dependent in the past, e.g. 140 for a 50-year-old and 160 for a 70-year-old today. The standard value for high blood pressure is generally known to be 140/90, which is much stricter compared to the past. Then, in 1987, the former Ministry of Health and Welfare changed the standard value for high blood pressure to 160/95. Compared to the previous standard of age plus 90, this was a much stricter guideline. In fact, even when I was seeing patients from overseas, it was rare to meet someone whose blood pressure exceeded 160/95. Given that background and the age demographics at the time, less than half of Japanese people were considered to have high blood pressure, so the number of patients was actually quite low. However, from here on, the standard values for high blood pressure started to become much stricter. In 2000, the Japanese Society of Hypertension significantly lowered the standard value for high blood pressure to the now commonly known 140/90. The basis for this change was that many studies, both in Japan and overseas, showed that lowering blood pressure could help prevent future diseases caused by arteriosclerosis. In other words, when arteries harden due to arteriosclerosis, it can lead to heart and brain blood vessels becoming blocked, and in some cases, this can even result in death. That's why it was believed that lowering the risk was important. Of course, there are also drawbacks to lowering blood pressure too much, so I'd like to explain the details in the third part. Because of this, in the 2000s, the standard for high blood pressure dropped sharply, and the number of people diagnosed with high blood pressure and prescribed medication kept increasing. As a result, the number of patients visiting hospitals for high blood pressure grew, and the amount of medication prescribed also rose, leading to a significant increase in medical expenses. Furthermore, the trend of lowering the standard value for high blood pressure has not stopped. About 10 years after that, in 2019, the Japanese Society of Hypertension released new hypertension treatment guidelines. In these guidelines, for people under 75 years old, and for those with a high risk of vascular disease due to certain underlying conditions, the target blood pressure value was lowered from 140/90 to 130/80. As you can see, the target value for high blood pressure has been steadily decreasing year after year. Of course, there are reasons and circumstances behind the lowering of these standard values. values. Various studies have been conducted both domestically and internationally, and the data has shown that setting the target blood pressure at 130 rather than 140 is more effective in preventing future strokes and heart attacks. This is the background behind the lowering of the target values. Concerns exist about excessive blood pressure reduction, including medication side effects. For those over 80-90 with declined physical functions or in wheelchairs, questions arise about the extent of blood pressure lowering. Data suggests not lowering it too much in such cases. In April, REWA 6, the high blood pressure baseline changed from 140 to 160, prompting inquiries about the appropriateness of this change for those previously considered to have low blood pressure. Actually, the standard that was raised is not the target value for high blood pressure treatment guidelines that I mentioned earlier. So what exactly was changed? So, to put it simply, there are differences in the baseline values for high blood pressure within Japan, and also differences between Japan and other countries. Let me explain this briefly, starting with the conclusion. For health checkups, people who are not being treated for high blood pressure and have their blood pressure measured, until now, if their blood pressure exceeded 140/90, the health checkup results would say, please see a doctor. But from now on, if your blood pressure exceeds 160/100, the health checkup results will say, please see a doctor. That's the change that has been made. This is called the reference value for health checkups. Until now, when you had your blood pressure measured during a health checkup, if your reference value exceeded 140/90, you were told to go to the hospital. But now that reference value has been relaxed. Because of this, it's estimated that about 1 in 10 patients who would have been told to go to the hospital before will no longer need to go. That's the background behind this decision. However, there isn't any solid evidence for this. Rather, from a medical economics perspective, even if you have a health checkup, referring everyone with slightly elevated blood pressure to the hospital would dramatically increase consultations and potentially strain medical expenses. Exceeding the reference value once doesn't necessarily indicate high blood pressure. What's really important is the blood pressure values you measure at home, which I'll discuss in the third period. Just because your blood pressure was high during a health checkup, it doesn't necessarily mean your blood pressure is also high when you measure it at home. For many people, their blood pressure is high at the hospital, but it's lower at home. This difference between blood pressure at health checkups and at home is also a factor, and that's probably why the reference values have been relaxed this time. So, this change in the reference values is not a change in the treatment guidelines. By the way, according to the 2019 guidelines issued by the Japanese Society of Hypertension, the basic target for people under 75 and those without vascular risk remains to aim for 130/80. That standard hasn't changed. Please don't misunderstand that point. Also, just because the reference values for health checkups have changed, it doesn't mean you should immediately decide to stop taking your medication or anything like that. Suddenly stopping your medication can be dangerous, and when it comes to blood pressure values, it's not like everyone should aim for the exact same numbers. Depending on your age, your body's condition, and your overall health, as well as your medical history, your doctor will consider all of these factors and decide whether you should take blood pressure medication. If, after listening to today's talk, you're really unsure about whether you should be taking medication, I strongly recommend that you consult with your primary care doctor. Also, if you compare guidelines from different countries, you'll see that the guidelines in America and Europe are similar to those in Japan, and the target values have been lowered in recent years. For example, according to the 2017 treatment guidelines from the American Heart Association, the target value for adults is also 130/80. Similarly, the European Society of Hypertension updated their guidelines in 2019, and for adults, the basic target is to keep blood pressure below 140/90 for people who can lower it further, or for those who have diabetes and are at higher risk for vascular disease. The recommendation is similar to Japan's, aiming for 130/80. Does that make sense? Despite domestic and international guidelines lowering blood pressure baselines, the National Health Insurance Association's health checkup baseline remains more lenient in comparison. So you might be wondering what the actual benefits are of lowering blood pressure and why we are trying to lower it so much. Let me explain this. First, I'll talk about the merits of lowering blood pressure. As I mentioned earlier, lowering blood pressure can reduce the risk of stroke, heart attack, and ultimately lower the mortality rate from these conditions. As I mentioned earlier, the treatment guidelines have been gradually lowering the target values year by year. Now, let me explain specifically what benefits there are to lowering blood pressure and how much of an effect it has. Lowering blood pressure to a certain level can reduce the risk of stroke, heart attack, and future mortality, which is the main benefit. However, there is one thing to be careful about. As mentioned before, blood pressure is often higher at the hospital than at home. When I see outpatients and measure their blood pressure, they sometimes ask if it's normal for it to be higher than usual. In most cases, it is okay. The hospital environment is different, causing your heart to beat faster and blood pressure to rise. This is called white coat hypertension, named after the effect of seeing someone in a white coat. Please take a look at this chart. The term white coat hypertension in the lower right is what I mentioned earlier. The white coat hypertension in the lower right is what I mentioned earlier. This refers to people whose blood pressure is high in the examination room but not high at home. On the opposite side, in the upper left, is this one. It's called masked hypertension. This is when your blood pressure is normal at the hospital, but when you measure it at home, it's unexpectedly high. Sometimes, when people are told by their doctor to check their blood pressure at home, they're surprised to find it's actually high. In other words, it's masked. It looks like you don't have high blood pressure in the examination room, but in reality, you actually have high blood pressure at home. That's the pattern. For people with masked hypertension, even if your blood pressure is low at the hospital, if it's high at home, it's said that you have the same risk of vascular diseases as people with regular hypertension. That's why, just because your blood pressure is fine at the hospital, don't assume you're okay. Please try measuring your blood pressure at home. If you think measuring your blood pressure is a hassle, just try it for a week. Measure your blood pressure once in the morning after you wake up and once at night before bed for a week, and then calculate the average value. If your average blood pressure is over 130/585, try non-medication methods to lower it or consult your doctor. Some think their blood pressure is low at the hospital, so they're fine. But 1 in 3 adults has high blood pressure, so 1 out of 3 viewers may have high blood pressure. Also, when the average blood pressure of Japanese people drops by just 4 points, it has a significant impact. Data shows that reducing blood pressure may save up to 10,000 stroke patients. Lowering blood pressure by just 4 points can prevent strokes in 10,000 people. Additionally, if your blood pressure drops from 150 to 140, the risk of cerebral infarction and other cerebrovascular diseases 27%, while the risk of myocardial infarction and other heart diseases 17%. Isn't that amazing? That's what they say. And regarding the overall mortality rate, it's said that lowering blood pressure by just 13% can make a difference. I also looked at Japanese data related to high blood pressure. There's a graph showing the risk of heart disease depending on blood pressure levels. As you move to the right, blood pressure increases, but if your systolic blood pressure exceeds 140, the risk triples. And if your systolic blood pressure exceeds 180, it's said that the risk increases 5-fold. So it's clear that lowering blood pressure too much can also be a disadvantage. You're watching this video. I think many of you are also worried. If your blood pressure drops too much below the baseline, symptoms like dizziness can appear, and there's data showing that the decline in cognitive function can progress more quickly. So, there is also some very interesting research data on this. For elderly people, and especially for patients whose physical functions are declining to the point where they may need to enter a facility, research suggests that it's better not to lower blood pressure too much below the guideline baseline. This is based on a study conducted in France and Italy involving patients over 80 years old who were living in facilities. The study looked at 1,217 people, and it found that those whose systolic blood pressure dropped below 130 and who were taking 2 or more types of blood pressure lowering medications had different outcomes compared to those who were not in that group. The results showed that the mortality rate was as much as 78% higher. Since this is a study from France and Italy, we need to be careful about applying it directly to Japanese people. But it's still a very interesting study. Of course, we can't make a decision based on just one study, but we can expect to see more research on high blood pressure in elderly people, especially those who are very old or living in facilities. Also, Japan is the #1 country in the world for longevity. There are very few studies that target people in their 90s or hundreds. In fact, even the guidelines' baseline values are not necessarily meant to be applied to people in their 90s or hundreds, so we need to be cautious. While the target blood pressure values for hypertension are set, there isn't much solid evidence for applying them to people of such advanced age. There is also something called the SPRINT trial. This SPRINT trial is well known. The target value for high blood pressure is set at 130/80. That's the background behind it. However, in a secondary analysis, especially among people over 75 years old or those who are frail and have decreased physical function, the study limited its analysis to these patients. It turned out that lowering blood pressure did not actually reduce the rates of stroke or heart attack deaths in these groups. For people over 75 with declining physical function, lowering blood pressure may have more downsides. The medication itself can burden the body and become more of a disadvantage. There is a higher likelihood of this being the case. I myself, when I was prescribed blood pressure medication by another doctor, experienced side effects like swelling, decreased kidney function, and my blood pressure dropped too much, which made me feel dizzy. I've also had side effects. If you're dealing with side effects from your current medication just to lower the risk of future heart attacks, it may not be worth it. That's why weighing the pros and cons is crucial. Depending on age and physical condition, we set a target blood pressure and decide on medication. The guidelines provide a standard target, but that doesn't mean everyone should aim for the same blood pressure. It's crucial to consult with your primary care doctor and make joint decisions rather than deciding alone. So, in the end, how should we make these decisions? I'll explain that now. As I mentioned earlier, the foundation of hypertension treatment is a tailor-made approach. The decision depends on your age and the condition of your organs. There are also other important factors to consider. For example, your attitude and thoughts about taking medication. Even if you know the risks of high blood pressure, if you have had bad experiences with medication in the past, or if you simply don't want to take medicine, that's something to consider as well. It's important to communicate your feelings clearly to your doctor and discuss your options together before deciding whether or not to take medication. Also, medication isn't always cheap. You might wonder, if I take this medicine for years, what kind of risks will I face? Depending on the medication, the cost can add up to tens of thousands of yen over the years, so please consider carefully before deciding to take this medicine. If taking the medicine doesn't significantly impact your future mortality risk, if you're going to spend tens of thousands of yen over the years, you might be happier spending that money on delicious food instead. That's a valid perspective. When doctors prescribe medicine, we always consider the benefits of taking the medication. We consider the side effects, your way of thinking, and our experience as doctors who have prescribed medicine to many different patients. We discuss everything together, and then decide whether or not you should take the medicine. Don't rely solely on data or guidelines when deciding to take medicine. Such decisions shouldn't be made lightly or automatically. In reality, I never simply prescribe medicine just because a certain value is exceeded, so the actual benefit of taking medication for high blood pressure may not be as great as you might think. There is research that supports this. It's called a systematic review. It's a highly reliable paper that systematically gathers and analyzes various studies related to high blood pressure. Patients over 60 who have high blood pressure. They divided about 27,000 people into two groups. One group had their blood pressure strictly controlled to below 140, and the other group received standard high blood pressure treatment. When they compared the two, they found that the group with stricter control below 140 had a lower mortality rate due to heart and blood vessel problems, as well as a reduced risk of developing conditions like heart attacks, strokes, and heart failure. What's interesting about this paper is that it shows something called a time to benefit. Time to benefit refers to the number of years you need to continue this medication before you can prevent one case of heart attack or stroke. For example, let's say a doctor carefully controls the blood pressure of 500 people so that their systolic blood pressure drops below 140 and prescribes medication accordingly. After 9 months, how many people in that group will have avoided a major event like a stroke, heart attack, or death? The answer is just one. In other words, by prescribing medication to 500 people for 9 months, the doctor is able to prevent just one such major event. In other words, the remaining 499 people who took the medication for 9 months did not experience a heart attack or stroke, regardless of whether they took the medicine or not. Excluding one case, there was no difference between the 499 people who took the medication and those who did not. That means they did not develop a future stroke or heart attack. If you think about it as 1 in 500, some people might think that the benefits of taking anticoagulant medication are low. Well, even if it's 1 in 500, it's still a serious event, so there are also people who want to take medication because they want to lower their own risk. In the end, it's a matter of how you think about it. I know this is a bit of a difficult topic, so please feel free to listen to it as many times as you need until you understand it. This is a review of what we've covered so far. First, I explained the background that the target value for high blood pressure has been gradually lowered over the years. Second, I explained that the baseline for receiving a health checkup or being diagnosed with hypertension at a health screening center has risen from 140 to 160, and that about 1 in 10 people are now being caught with a milder baseline. I also explained that there haven't been major changes in treatment guidelines of each country. Regarding the benefits and drawbacks of lowering blood pressure, I explained there are merits and demerits, such as increased risk of cognitive decline if blood pressure is lowered too much, or side effects from medication. Furthermore, for people over 80 or those with declined physical functions, lowering blood pressure too much may increase the mortality rate. In the fourth session, I explained that even with medication, it takes time for the risk to decrease due to time to benefit. So, who should we prescribe it to, and who should we not? I explained in detail about cerebral and myocardial infarction and their prevention. There aren't many videos that cover this topic so thoroughly. At YouTube Medical University, we are committed to delivering videos that can help you become healthier starting tomorrow, based on data from a doctor's perspective. If you want to learn more, please subscribe to our channel so you don't miss any of our new videos. We would really appreciate it. Also, every Tuesday at 9 post-meridian, we do a YouTube live where we talk about health, so please join us. If you have any thoughts or questions about today's video, please feel free to ask them during the live stream. Of course, it's also perfectly fine to leave your questions in the comments. In conclusion, there were pros and cons to using medicine only as a last resort. However, this doesn't mean medicine should be avoided entirely. Is it possible to lower your blood pressure through your diet? In this way, without relying on medication, I'll explain methods to lower your blood pressure. In other YouTube videos, things like breathing techniques and stretching have been introduced, but this time I'd like to focus only on things that have actual data behind them. There are also videos that recommend things without solid data, but that doesn't necessarily mean they're bad. It's just that we don't know for sure if they're effective or not, so trying them is your own responsibility. Therefore, in this video, I'll only introduce things that have a certain amount of data supporting them, so I think it's better to try these rather than things without any data, and I'll be introducing things that are relatively easy to incorporate. So, the diet I want to recommend for lowering blood pressure is the Dietary Approaches to Stop Hypertension diet. The Dietary Approaches to Stop Hypertension diet. If you haven't heard of it before, don't worry. The important thing is not the name, but the content. The Dietary Approaches to Stop Hypertension diet was developed in America as a way to lower blood pressure, but what kind of features does it have? So, what should you eat instead of limiting salt and carbohydrates? The answer is minerals like calcium, magnesium, and potassium, as well as dietary fiber. A diet that emphasizes these is called the Dietary Approaches to Stop Hypertension diet. You don't have to strictly follow this diet completely. What I want to convey here is that by incorporating foods rich in these dietary approaches to stop hypertension diet nutrients into your daily life, there's a possibility that your blood pressure may go down. What should you eat? Fruits, vegetables, tofu, and dairy products. But is there data to support this? When patients with high blood pressure tried this Dietary Approaches to Stop Hypertension diet compared to those who didn't try it, data shows that patients who tried the Dietary Approaches to Stop Hypertension diet had an 11.4% drop in systolic blood pressure and a 5.5% drop in diastolic blood pressure compared to those who didn't. This effect lasted for 8 weeks after starting the diet, providing long-term benefits with consistent adherence. If you're concerned about your blood pressure, try replacing high-sugar snacks with fruits when hungry. For example, bananas are rich in dietary fiber and also contain plenty of potassium. Just by replacing your usual potato chips with bananas, your blood pressure might go down. As a small tip for lowering blood pressure, I recommend Yasashio. It's a type of salt that uses potassium. Yasashio contains some sodium, but about half of it is made with potassium salt. Potassium is getting a lot of attention. In the dietary approaches to stop hypertension diet, potassium is said to be important, while regular salt contains sodium, a cause of high blood pressure. However, potassium salt helps the body excrete sodium, removing it from the body. That's why it can help lower blood pressure. Regarding potassium, there is data. For people with high blood pressure, taking 0.176 ounces of potassium daily can lower the upper blood pressure by 7.2 and the lower by 4.1. A 10-point drop in blood pressure reduces the risk of various diseases from 20% to 10%. The average daily potassium intake for Japanese people is only about 2 to 0.08 ounces, which is insufficient to naturally lower blood pressure. By using this seasoning, you can simultaneously reduce your regular sodium intake and increase your potassium intake. It means you can both suppress the factors that raise blood pressure and take in ingredients that help lower it. Using Yasashio's healthier salt instead of regular salt kills two birds with one stone, as salt is used in virtually every dish. Making this simple switch should have an effect. I'm broke. If you have kidney issues, be cautious when using Yasashio, as declining kidney function can lead to high potassium levels due to poor excretion. Consult your primary care doctor about it. Some data shows that blood pressure can decrease. Food and lifestyle guidance is over here. This is fish oil. Eicosapentaenoic acid or eicosapentaene-san, docosahexaenoic acid or docosahexaene-san. These are found in mackerel and sori, for example. These are components commonly found in blue-backed fish, and there is data showing that for people with high blood pressure, taking these can lower blood pressure by about 4 to 5 points. However, it's not something that can be done easily. Exercise is also effective. Regarding exercise, it's said that those who did aerobic exercise 3 times a week had their blood pressure drop by 5 to 10 points compared to those who didn't. As for diet, there is also data showing that if you eat 11 servings of vegetables a day, your blood pressure drops by about 1.2 points. Surprisingly, there is also data showing that if you consume 5 milligrams of potassium a day, your blood pressure drops by 2 points. To summarize, it's best to eat foods that help lower salt intake, such as fruits. Try to eat more vegetables, especially those that are rich in magnesium and calcium, which I mentioned earlier as being found in leafy greens, broccoli, avocados, and so on. Make an effort to include these kinds of vegetables in your diet. Also, consider replacing meat with fish oil in your diet. This change alone can significantly reduce your blood pressure, making it worth trying. Although I shot this video hastily, my blood pressure, a key health metric, dropped from 140/160 down to 140. This prompts reflection on hypertension, but it's still somewhat surprising. Even though it's being reported, it's still a bit surprising. I wanted to provide a detailed explanation due to lack of coverage. I emphasized it in this video, but given the changed standards, I wanted to address it directly. It's a bit risky to think that it's okay not to take your medicine or not to go to the hospital. Target blood pressure varies significantly based on age, physical condition, and underlying diseases. This is Odameido, and your way of thinking is important. If you have even a slight doubt, it's best to consult your doctor to see whether you should continue taking your medicine or stop. Please feel free to consult with them if you're unsure. If you could rate this video with either a good or bad button, it would help us improve in the future. Also, if you have any experiences like, when I ate this, my blood pressure went down, or my doctor told me to take this kind of blood pressure medicine, please share them in the comments. It might help others who are in a similar situation. I'll see you again in the next video. I'm Amano from the Department of Integrated Medicine, and I'm sharing the best advice for living a healthy life from your 70s and beyond, as taught to me by my patients in Shikoku. The book became the top gift. As a doctor, I compiled the important lifestyle and health tips I learned from my patients into one book. I want to live a healthy life too. This book is for like-minded individuals. It's on sale with great reviews, so please check it out.